Medicare. Health care for the aged, the disabled, and those with chronic renal disease. Medicaid. Medical assistance for needy Americans of all ages. Clinical Laboratory Improvement Program. Safe and accurate laboratory testing. State Children's Health Insurance Program. Health insurance for millions of uninsured children.
Hello, I'm Vanetta Harrison from the Centers for Medicare and Medicaid Services. I'm also the Native American contact for Region 2. I want to share with you important information about health insurance and the Native American community. Native Americans face some of the highest rates of disease in the nation. According to the National Health Interview Survey, Native American communities face many health challenges, including higher mortality rates from tuberculosis, liver disease, and pneumonia compared with other racial and ethnic groups. Substantial health challenges also exist from many conditions, including heart disease, tuberculosis, sexually transmitted infections, and injuries. The rate of diabetes is higher in the Native American community than any other major racial or ethnic group in the United States, and the rate is increasing. Having access to preventable services and treatment is critical for Native American health. Health insurance is important for all Native Americans, no matter where they live or what age you are. Whether it's Medicare, Medicaid, accessing services through the Indian Health Service, or new options for health insurance made available under the Affordable Care Act. Health insurance allows you to visit a doctor on a regular basis, manage complicated medical conditions like diabetes so that they do not get worse, and helps prevent future illnesses. Insurance also protects you from high costs when something bad happens. No one plans to get sick or hurt, but most people need to get treated for an illness or injury at some point, and health insurance helps pay these costs. Access to health insurance will become easier to purchase for many Americans this year. The Affordable Care Act, which is sometimes called Healthcare Reform or Obamacare, made big improvements in how you receive care and how it is paid for by the government. Some you may not even be aware of. This includes permanently reauthorizing the Indian Health Care Improvement Act and strengthening and improving health care for 1.9 million Native Americans across the country. The law also gives health insurance services the authority to establish expanded health care services such as mental and behavioral health treatment and prevention, long-term care services, dialysis services, facilitation of care for Indian veterans, and urban Indian health programs. In addition to Indian health services, choices for health care coverage will include greater access to Medicaid, more private insurance options, and access to the Federal Employee Health Benefit Program for tribal employees. Did you know that young people can stay on their parents' insurance up to the age of 26? Or that children cannot be denied health insurance because of pre-existing conditions? Many preventive services are now available without cost. That means that more Americans will receive cancer screenings and other services that will help them get and stay healthy. Health insurance reform also expands Medicaid coverage to and provides more Native Americans an opportunity for coverage. This fall, health insurance marketplaces will create new choices for purchasing more affordable insurance. They will help people compare health plans based on value and will provide answers about health care options. Coverage starts January 2014. Stay informed about health insurance by visiting www.healthcare.gov, and to learn more about Indian Health Services, visit www.ihs.gov. Welcome to CMS and You. I'm your host, Vanetta Harrison, along with my colleague, Michael Cutler. Each month, we bring you up-to-date information from the Centers for Medicare and Medicaid Services, or CMS. CMS is the federal agency that administers Medicare and oversees Medicaid and the Children's Health Insurance Program, as well as numerous other national health-related programs. Today, we will be talking about something that you might take for granted, your vision. There is more to maintaining good vision than wearing glasses or contacts, and you should be aware of different visual concerns at different ages, from childhood through adulthood. Did you know that in New York State, more than half of all people over the age of 65 have had cataracts? It is important to take visual health safely. Michael, would you please tell our viewers what is covered under Medicare and Medicaid?
I'd be happy to, Vanetta, thank you. Vision health is covered under several Medicare and Medicaid programs, and we encourage you to take full advantage of what is available to you. Under traditional Medicare, it is important to note that although routine eye exams are not covered, Medicare does cover many of the costs associated with having cataract surgery, and then will also help to pay for a new pair of eyeglasses or contact lenses after cataract surgery. Medicare also helps pay the cost of an annual glaucoma screening for individuals at high risk for glaucoma, as well as African Americans who are age 50 or older. You may not know this, but Medicare will also help to pay the costs associated with replacement and maintenance of an artificial eye. Medicare Part D will help pay the costs of prescription drugs, including medicines needed to treat eye diseases and glaucoma. So for those Medicare Advantage folks, please check with your plan. Medicaid, on the other hand, will cover vision benefits for eligible children under age 21 through the Early and Periodic Screening, Diagnostic and Treatment Program, which we abbreviate and call EPSDT. Now, beyond EPSDT, Medicaid coverage is different from state to state, so be sure to contact your local Medicaid office for additional information about what eye health services you or your family member or your friend may be eligible for. Back to you, Vanetta. Thanks.
We are fortunate to have with us today Dr. Chandak Ghosh, an ophthalmologist in New York City. Welcome to our show, and thank you for being here. We'll just go right into our questions here. Many people do not know very much about their eyes. Can you explain to us the parts of the eye?
Sure. As you know, the eye is a very complicated organ. So I brought this model here to help me explain the different parts of the eye. So the clear part of the eye, of our eyes, is called the cornea. That's the dome in the front of the eye. The white part around it is called the sclera, and the lids go over it. Over this white part is a very thin piece of tissue that contains blood vessels, and that's called the conjunctiva. So let me open up the eye. There we go. And it looks like it's like a ball. It seems like it's hollow inside, but it's not. It has a lot of clear fluids and gels. So let me go through that. So behind this cornea, we have the iris, and that's the part of the eye that gives our eye color. Blue, brown, green, it all depends on how much pigment you have. Behind the iris is the lens, and this is just like a camera lens. It focuses along with the iris, which opens and closes depending upon how much light, and it focuses an image onto the back of the eye, which is the retina. And the retina you see here with lots of blood vessels is actually an extension of the brain into the eye. So if you're looking around and you focus on some object, say you're focusing on your cat, the light from that object comes through the pupil, through the lens, and hits your retina. Your retina sends that message back to your brain, and your brain says, oh, that's my cat. So this part here in the middle that I talked about is a gel. It's actually a clear gel called the vitreous. And as we get older, that gel begins to be more and more liquid. And some people may see flashes of light, and that's when that vitreous gel is pulling on the retina. And normal flashes of light are fine, and it may end up with little dark things that are floating around called floaters that you see in your vision, especially on a sunny day. But at worst, what it could do is it could also pull off the retina, and that's called a retinal detachment, and people normally see a curtain coming down, and that's something to see your eye doctor for. The lens here, as you get older, becomes cloudy, and that's what's called a cataract. And we do a very common surgery where we go in through the front of the eye, break up the cloudy lens, suck out the pieces, and put in an artificial lens so you can see better. And as I put back the cornea here, between the cornea and the iris is another liquid, a clear liquid. And when that begins to pile up and become pressurized, that's a sign of glaucoma. And glaucoma is a disease of high pressure in the eye, which ultimately could kill off the back of the eye called the optic nerve, which takes the messages to your brain. So as I close this eye back up, two more things. The conjunctiva I spoke about. Sometimes it gets very red and irritated, could be infected or allergies. Sometimes we call it pink eye. It's officially called conjunctivitis, like the conjunctiva. And finally, the cornea. When we do laser, called LASIK surgery, for people who are nearsighted who want to see without glasses, we do laser right on top of that cornea. So that's the eye.
Oh, thank you. Quite complicated, but interesting. Now, please share with us the different roles between ophthalmologist, optician, and optometrist.
Ophthalmologist, optometrist, and optician. It's really confusing, isn't it?
Yes,
All those
it
ops.
is.
Well, the op means eye, so they all have to do with the eye. The ophthalmologist is actually a physician who specializes in the eye and looks at the eye's health as an extension of the body's health. So the ophthalmologist is trained to diagnose and treat a full range of diseases or conditions like needing glasses, or glaucoma, or cataracts, a diabetic retinopathy where diabetes affects the eye. And the ophthalmologist can use all the tools in his cabinet to help treat these diseases. So that could be drops, antibiotic drops, glaucoma drops. It could be antibiotic pills. It could be laser. It could be surgery. So the full armamentarium, we call it, of treatments. Now, while an ophthalmologist goes and graduates from medical school, an optometrist goes to optometry school and also learns about the eye. But most optometrists deal with people who need glasses and getting the right pair of glasses for them. When you go into a store, a glasses shop, often you'll have an optometrist there that helps you figure out what kind of glasses you have. They also look at the whole eye as well, and they treat early symptoms of these diseases like glaucoma and cataract. But if you need some treatment for a worsening of disease or you need surgery, they'll usually refer you to the ophthalmologist. And the final one of the three is the optician. An optician is someone with an opticianry certificate, and they're the ones who physically grind the glasses to your prescription and put the glasses into the frames, and they can also be seen selling the glasses to you at these stores. So those three, ophthalmologist, optometrist, optician, all deal with eyes but do different things.
Okay, looking at visual health over a lifespan, what should parents look out for in their young children?
Right, it's a great question. Actually, parents should have some comfort in knowing that all from birth all the way to about grade school, there are a lot of people looking at your child's eyes. So before your child's sent home from the hospital after she's born, a pediatrician will take a quick look at the eyes to make sure the general things are okay. When the child goes to the pediatrician as she's growing up, every time the pediatrician will also do some general eye care. When they go to school, they get screened for visual problems and the need for glasses. What parents really should look out for is to see whether the eyes move together. Do they both move together, or do they cross or separate? So if they cross or separate, that's called strabismus, and it could be a sign that the eyes are not seeing correctly. So that needs to be evaluated. Sometimes you can put glasses to fix it. Sometimes you have to do surgery to fix it. There's another condition that parents should be aware of called amblyopia, and that's when one eye needs glasses and the other one doesn't. So the child is walking around just fine, sees everything fine with the eye that doesn't need glasses, and you can't tell that the child can't see anything because the child's seeing. So what happens is the brain, because it's not seeing in the eye that does not have glasses, puts all its energy toward the eye that sees well. So unless that's corrected by age 8 or 9, the brain will move all its functioning toward the eye that sees well. And no matter what you do with the eye that does not see well, even give glasses